President Biden is calling on states to make COVID-19 vaccines available to all adults by April 19th, if they haven't done so already. His administration had originally set a deadline of May 1st.
By no later than April 19th, in every part of this country, every adult over the age of 18 or older will be eligible to be vaccinated. No more confusing rules. No more confusing restrictions.
The administration says 150 million vaccine doses were administered in the president's first 75 days in office. Despite this progress, the number of new coronavirus cases has spiked for 4 weeks straight. The White House is now racing to get more Americans the vaccine. The country is averaging a record 3 million shots a day. According to the CDC, nearly 1 in 3 Americans, or more than 32% of the population, has received at least one dose already. For the latest, let's bring in CBS News reporter Alex Tin, who has been covering the nation's pandemic response. Hi there, Alex. So what more can you tell us about the White House's new eligibility deadline and how it could change the timeline of more people getting vaccinated?
Thanks. Well, that context that you mentioned, where the original deadline was May 1st and now it's April 19th, is really important to consider. When he made that first deadline of May 1st, we were in a very different place. Most states had not laid out yet their clear timelines for how they plan to open up eligibility in their states, from the first groups that were prioritized to these broader sets of populations. Now, what we knew then and what we know now and what we've heard from state officials is that they had always planned to expand eligibility to all adults. Many of them had already been targeting a date at some point in April to expand eligibility, as long as federal commitments about supply held up, and they appear like they are holding up. And so what we saw this morning, which is very different than what we saw last month, is when the president's administration made this announcement, and then the president came out and made this announcement on camera, already nearly all of the United States and the District of Columbia had already laid out a clear timeline for how they plan to meet that May 1st goal. In fact, right now, all the states except 14 had already opened up eligibility to basically every adult within their boundaries. And almost all of the remaining ones, with the exception of 2 states in the District of Columbia, had planned already, publicly committed to meet that April 19th deadline. So this is a very different situation. When the White House press secretary was asked about it today, she said that, they weren't trying to claim credit for it, but really this was an attempt to just make it clear for the American public that this is a date, even if you haven't been closely following your state's allocation politics, even if you haven't been closely following the policies around that you are likely going to be able to at least attempt to register for a shot on April 19th.
All right. Well, hundreds of thousands of people we know have been vaccinated at Walgreens drugstores, but there has been some controversy over their administration of second doses. What's behind that, Alex?
Well, it's a really interesting situation, and this was first reported, I think, by the New York Times, that Walgreens had initially set up a system to register folks for their first and second doses of either the Pfizer or Moderna vaccines. And those vaccines, while not the same, are very similar in a lot of ways. They're 2-dose regimens. The doses have to be spaced a specific distance apart. And the CDC really, really urges people, don't get that second dose early. You should get it after a specific recommended interval. You can get it a little bit later if you have to, but the data suggests you should not get that second dose early. So the system that Walgreens set up was that they were scheduling both the Pfizer and Moderna vaccine recipients with the same default 28-day spacing. Now, that's just fine if you're a Moderna vaccine recipient. That's the recommended interval between your first and second dose. But if you're a Pfizer vaccine recipient, your recommended gap is 21 days. And so that difference between the 21 and 28 days, while it's not clinically perhaps that's significant. In fact, you've even heard some health experts advocate for delaying the second dose as a way to speed up vaccinations. And we don't think there's any safety reasons for it. But we also don't have data around how that truly affects the immunity of the second dose. And the CDC has really urged people, don't delay that second dose. You should get it as close to the second recommended interval as possible. And in this case, they told us, they confirmed to us that they reached out to Walgreens and said, you need to fix this in your system. People need to be out, scheduled for that second dose at the recommended interval. Walgreens tells us they're planning on rolling out that fix this week.
Well, Alex, the CDC has updated its guidelines for face coverings. What's new on that front?
Well, the updated CDC guidelines for face coverings are part of a slew of updates we've seen over the past month or so as they've gone through and really re-examined the evidence around transmission and the disease itself and made all these small tweaks and bigger tweaks to everything about cleaning and disinfecting. You saw that yesterday, to face masks today. And the tweak they made, which is interesting, is specifically targeted at folks with facial hair. If you have a beard, the CDC recommends still and has always recommended that you wear a mask. But now they acknowledge that if you wear a mask with a beard, there may be a gap along the bottom where it doesn't fully seal with your face. They acknowledge that, they recognize that's happening, but they still urge you to wear a mask, to wear it all the time, and it's likely going to at least curb the spread of COVID-19.
All right, something we'll certainly continue to watch. Alex Tin for us. Alex, always good to see you. Thank you.
Thank you.